The Senate bill manages to get through the Senate later this week, it would have to be reconciled with the House version, which was passed last month. All three Minnesota Republican congressmen voted for that bill, including Congressman Tom Emmer, who is joining us right now. Congressman Emmer, thank you so much for coming on.
Thank you for having me, Esme. Good morning.
Good morning. Let me ask you, sir, about the House version of the health care bill passed last month. The president held a ceremony celebrating the passage in the Rose Garden. And this week he called that bill mean.
Yeah.
What does that mean?
Well, first off, I didn't participate in the Rose Garden event. I thought that was wrong. I think the House kept the matter alive, sending it over to the Senate, and he celebrated it in the Rose Garden event. The president did. Today, or yesterday, whenever the term came out that you just referenced, as I said to you before, if he's giving senators some cover for whatever reason, he negotiates in an interesting way. I'm all for it, but I think you're going to find out. We're all trying to solve a problem that both Republicans, Democrats, Americans realize we have. You've got a third of the counties across the country will be without a choice for health care insurance.
Under the current plan.
Under the current plan. And this is trying to address that. That's exactly right.
All right. Is this going to fly, though? I mean, it doesn't look like it's going to get through the Senate. The House has its bill that the president's calling mean. I mean, are you going to be able to get something out of this?
Well, remember, I don't know what the president is calling mean. He's referred to the House bill now after he said that it actually made sense. Now, over on the Senate side, my understanding is there have been some changes made. For instance, the Medicaid expansion, which nobody seems to want to talk about. I mean, I heard Senator Franken's comments about how somehow this was going to give a big tax cut to folks and it's going to take money away from seniors, when in fact the Medicaid expansion under the Obama administration and the Affordable Care Act added working-aged, able-bodied adults to the Medicaid program, which was intended for the working poor and seniors. So we're trying to solve a problem, Esme, and I think as we go forward, you're going to see some changes in the Senate bill over the next couple of days. Dean Heller, the senator from Nevada, who said he's not on board, the rest of his statement was that doesn't mean that he's not going to vote for it. There have to be some changes made to the benefit structure. And I think at the end of the day, we have to recognize this. Once you strip away all the rhetoric that's going on, I don't care if you're a Republican or a Democrat, Americans know that we have to fix this thing, and we have to look at it from the big picture. How do we take care of people who need the care the most? How do we give people access to the greatest health care on the face of the planet? I think that's what everybody's trying to do.
All right. Let me ask you about the Russia investigation. The president has repeatedly called it a witch hunt. Is this a witch hunt?
Well, I think you've got a special prosecutor out there. You've got a House committee that's looking into stuff. I'm not going to get into what it is or what it isn't. I think you got to let Congress and the process work itself through. So far, we haven't seen anything to confirm or deny, and I'm just not going to. I'm not going to sit before you and try to tell you it's something when I don't know what's there.
All right. Let me ask you, you were the lone supporter of President Trump during the campaign. You were there at that rally 2 days before the election. He very nearly carried Minnesota. He did very well here. Let me ask you, in terms of your support for the president's policies, you have broken with him on the issue of Cuba. You were very much in the lead on trying to open up Cuba both to tourism and to local businesses.
Yeah, well, and I still am. And as for being the lone supporter, clearly I was not the lone supporter, since he almost won the state.
I'm sorry, the lone Republican official or elected official, perhaps.
A lot of Minnesotans were on that side as well. But as far as his position on Cuba, I believe the president has frankly tried to honor a campaign commitment to a very small group of people. Perhaps less than 5 in Congress. It happens to be a group who you might have seen speaking at the event that was held last week. The idea that we would go back to a failed Cold War policy, I think not only is it honoring a commitment to a very small group of people, but it potentially is breaking a promise to the American public, which is this president is all about safety and security of Americans and our homeland. And you got an island 90 miles off the Florida coast that's going to see a leadership change for the first time in almost 6 decades next February. The idea that we would withdraw at this point and allow Russia, China, the Iranians perhaps, or maybe even another Noriega-type leader to rise up within the still very powerful military in Cuba, I think is short-sighted and very narrowly focused, and it's not really taking into account the national security issues that are involved. So we're going to continue to push for not only access to the Cuban market when it comes to our agricultural products, when it comes to our medical supplies that we're so good at here in Minnesota, but it's really about the bigger picture. Again, not a Republican-Democrat issue. This is about American safety and security.
All right. Well, Congressman Emmer, always a pleasure. Thank you so much for coming in this morning.
Thank you, Esme.